Welcome and thank you for joining. My name is Dr. Jesse Morse and I am one of the doctors here at the Osteopathic Center. We are a clinic in Miami. We have a couple different locations and I wanted to give you a little bit of an idea of exactly what we do. So this will be a non-surgical orthopedics kind of general overview of one of the things that we do at our clinic. So where are we located? We have an office here in Miami. We have an office in Jupiter, which is about an hour and a half, 2 hours north near West Palm Beach. And we also have an office in Tennessee, in Knoxville. So you have a couple different locations depending on where you live. So in general, if you walk through and follow me on our website, theosteocenter.com, you can kind of get an idea of what I'm going to be talking about and kind of get an idea of all the different options that we have here. So we decided to create this podcast, and my partner, Sean, Dr. Goddard, will be here intermittently. He's at one of the other clinics today, so not able to join me on this. But my goal and our goal is to kind of not only promote medicine, but also kind of describe exactly what the different types of medicine there are these days. Everything has become so specialized, and some people don't know all the different options. Some doctors don't even know the different options. Physical therapists, chiropractors, hospital staff, medical assistants, and that type of staff. And then obviously the non-medical lay personnel. They obviously like, well, what are all these different options that are available these days? So that's kind of, we decided that would be a good platform to use to kind of clarify, explain, promote, and just kind of get a better idea of what's going on in these post-COVID times. So I'm recording this in mid-October 2020. And we've obviously seen a lot of changes over the past 6 months in terms of the United States and the whole world, but also over the past 10 or 15 years, not only the orthopedics, but also the regenerative medicine world has dramatically changed. Non-surgical orthopedics is what I specialize in. So I'm family medicine trained and I have a sports medicine fellowship. I worked on staff at multiple different collegiate and professional teams, and as well as ran an orthopedic clinic where we saw all orthopedic related injuries, whether it's a fracture or a sprain or something that needed surgery, back pain, everything under the sun that you'd think of at a traditional orthopedic clinic, I helped to take care of. If it needed surgery, I would refer it to surgery. If it didn't need surgery or didn't want surgery, then that's kind of where I specialize in. Sean does a lot of that, but also does a lot more regenerative medicine work, and we'll talk about that in a little bit. So when you think of orthopedics, most people think, oh, surgery. Unfortunately, that's not always the case. That's an option, but that's not the only option. It really ultimately depends on what the injury is, the severity of the injury, different choices in terms of age, what is your profession, what are your goals? Are you a professional athlete? Are you a weekend warrior? Or are you just not trying to be miserable, getting out of bed in the morning and constantly having pain? So some of those different factors will affect how we decide which options are the best for you. So whenever I say orthopedics, I traditionally think of any musculoskeletal injury, whether it's back pain, knee pain, a fracture, a shoulder pain, rotator cuff, ankle injury. I mean, it covers so many different things, and it's only a matter of time before each one of us deals with something of this capacity, whether it's you slip and fall and roll your ankle, whether it's you all of a sudden have random back pain that starts shooting down your leg. Maybe you have shoulder pain because you lift something heavier than you thought it was, or you fell and accidentally broke your wrist. All of these things happen, unfortunately, just part of everyday life. So this should help to slowly inform you what are the different options, and we will happily take questions, comments, and if you want a consult, we will happily be able to provide one of those to you as well. And I will leave the name and number in the information below. So traditional medicine, traditional orthopedic medicine involves a combination of fracture management, whether it's bracing or surgery. You can have conditions like trigger point injections or trigger point issues where your fingers get stuck. We have all different types of options for knee pain, whether it's an acute injury like a meniscus or a ligament sprain, or it's a little bit more serious like osteoarthritis, or if it's true bone-on-bone osteoarthritis, and we need to talk about the different options that you've tried and that are still available. Then we have the good old famous steroid injection, which is still readily used every day. When I was in traditional medicine, I would do anywhere from 15 to 25 a day, just depending on how busy that day was and the injuries that came in. And then we have other courses of action, different medications that we can use, resources like physical therapy, occupational therapy, and a couple different other modalities that are very helpful as we work together to get the person back to full health as much as we can. Now, at this clinic, at the Osteopathic Center, we offer a couple additional levels of care. America is not very commonly used in the term integrative medicine. So what does that mean? That's just utilizing different non-traditional Western medicine and using a little bit more either Eastern medicine or a combination between osteopathic manipulation. This includes something along the lines of ozone therapy. Ozone is a gas where a couple different oxygen molecules are combined, and this is used to help reoxygenate tissue, decrease inflammation, among other things. We can use different types of injections that are considered natural and not either a steroid or a regenerative medicine product. There is also different types of epidurals that you can do that have dextrose, which is called prolotherapy, or other different options that are considered under the integrative medicine umbrella. Oftentimes we even use IVs to help with rehydration or vitamin supplementation or a decrease of inflammation depending on what we're trying to treat. And then finally, we will include and we also do a lot of regenerative medicine. So this is the booming area of medicine as we go forward in the next 20, 30, 40 years, where we actually use cells, whether they're from us or from someone else, to try to really regrow or heal the tissues naturally, as opposed to structurally fixing them by hand, which is basically surgery, or injecting a medicine like a steroid, which essentially decreases the inflammation but can also be harmful to the local tissues. Regenerative medicine is a completely different level of medicine where we use either cells from your blood, cells from your bone marrow, umbilical cord cells, Wharton's jelly, which comes from the umbilical tissues and fluid. These are all different options that are included under the regenerative medicine umbrella. And this is a very exciting level of medicine, a lot of research and knowledge, and it's very effective. A lot of people have probably heard of PRP by now, and bone marrow, or what we call stem cell, even though that is more of a colloquial term and not a true accurate term, which we'll talk about at a moment in time. But there are so many new and exciting options, and it's hard to keep track of them all. Even for us that are in this field and we see this every day, this is very challenging to try to stay up on which methods are effective for which injuries, what levels of products lead to or are more helpful than others, and have we had better luck with this brand versus that brand, which kits, when we talk about PRP or bone marrow, which kits seem to be more effective or generate a better yield. So there's all these different options. So this podcast is going to be the beginning of a huge series of different options. We have a lot of stuff in store for you guys. We're going to do individual sessions on what is regenerative medicine, and we'll go through each of the different classes of products, how we extract them, what we use them for, what growth factors are most effective and found and capitalized in each one. We'll go through individual injuries eventually and say, all right, a rotator cuff injury, what it would be the best technique, what product would be the most effective, why, how many times does it take. These are all things that we've learned through a combination of training, whether it's medical training, formally or informally, experience, as well as additional certifications that we continue to keep us abreast on all of this important information, that if you don't keep track of it, you will easily lose it. A lot of this non-surgical orthopedics is about technique, is about knowing the anatomy inside and out, understanding which imaging modalities are the most effective. Why do I need an MRI for this when an X-ray is okay for that? Do I need both an X-ray and an MRI? All of these different options and different questions we're going to answer as we go forward. I wanted to start kind of in general with an overview so that we had an idea of a platform of where to go from here. But I could easily make this hours long, and that's not realistic. So I'm going to break it up. We will break it up into really 20 to 30 minute segments that you can use, whether you're at the gym, whether you're driving to work, whether you're on a walk, whether you're just sitting at home and relaxing, or you're taking a break and you're eating your lunch. These can be little snippets that we will produce weekly, and be able to broadcast, whether it's on audio, if you're a podcast believer and lover like myself, or you want video, which everything seems to be going to video, so we are providing both. The videos will be on our YouTube page and also a link on our website, and the podcast will eventually be available pretty much everywhere you can get podcasting. And I would encourage you to not only subscribe, but just kind of check out our website, see what your thoughts. There's going to be a lot of informative information in there that's non-biased, that's fact-checked. The studies are going to be linked there. There's a lot of different research and data. We have beautiful videos that are going to be added to discuss different types of injuries. And just this is all about informing the public to say, this is what the injury is, this is what the options are, what would you like to do about it? And that's what I do with my patients, and that's what I feel certain parts of the world are much more informed about their health, about medicine in general, even the generalized public, compared to, say, America. Certain parts of America are very just naive to a lot of this stuff. So we're trying to provide a platform to increase that level of general knowledge. And I'm trying to not be too specific, too medical, because it can get very complicated very quickly. So if there's a question or something that you may have, you can happily post it in the comments, and we will try to answer them, or you can easily reach out to us, whether it's on our Instagram page, whether it's on our Twitter handle, or any of the mediums that we have, that we will happily try to answer those if possible. So this will begin to conclude our first podcast. I tried to keep it short and sweet to kind of give you an idea what to expect, and we will build on what I briefly discussed today. Again, we're going to recap and say this is going to essentially discuss all the different types of non-surgical orthopedics. We're going to eventually discuss all the different modalities within regenerative medicine, whether that's stem cell, whether that's exosomes, whether that's peptides. We have all different potential things on the docket that we can talk about. Then we will also talk about integrative medicine, where Dr. Goddard is a specialist, and he's done this for over almost 10 years now, where he's very good at discussing and understanding things that maybe are not very common in America, but highly utilized and very successful in Asia, in Europe, and in South America, where we have a lot of our patients specifically come to us asking because that's what they're used to being treated with. We'll also talk about cosmetic therapy, different options for, do you want a facelift using your natural products? Do you want hair regrowth, which is very successful and very safe with the right product and the right provider? We'll also talk about sexual health. Can I use these stem cell products to improve blood flow to certain areas and certain body parts to improve sexual function? The answer is yes. So look forward to some of these podcasts and podcast episodes as we start to grow and build our episodes. And if you have any questions or requests, we would love to hear them. So thank you for tuning in, and look forward to the next episode. Again, this is Dr. Jesse Morse here at the Osteopathic Center. I'm currently in the Miami location. Please visit our website, www.theosteocenter.com. Thank you very much. We'll see you soon.